I'm going to be talking about living with myeloma today. Dr. Hourigan was absolutely wonderful in his description and talking about myeloma, so I'm just going to recap. I had gone into a lot more detail, but I think if I just recap a few of the things that Dr. Hourigan said, then I'm going to go on to talk about living with myeloma. And when I talk about living with myeloma, some of the things I'm going to touch on are living with the side effects from having myeloma itself, but also living with some of the side effects from some of the treatments that Dr. Hourigan actually spoke about before, and just how to deal with those. And then just lastly talk about my role and how it can actually help you through your journey with myeloma. So just recapping on what Dr. Hourigan said previously was some of the side effects that you may actually experience having myeloma are from the effects of those plasma cells in the bone marrow, the abnormal plasma cells overcrowding the bone marrow and not leaving too much room then for the white cells, the platelets and the red cells to actually be made in the bone marrow. So we end up with symptoms such as fatigue, anaemia through the lack of red cells, which of course then can lead to fatigue, kidney damage due to renal failure, which is because of those paraproteins that we see in the blood, can actually cause some issues with our kidneys. It can also be caused from the leaching of the calcium from the bones, which then of course can lead to an excess of calcium in the blood, which makes the kidneys work harder. They trying to excrete a lot of that calcium in the urine, which can lead to dehydration. Recurrent or persistent infections, which can be caused by, again, that overcrowding of the bone marrow, so we don't have the room then for the white cells to be produced. Bruising, again, from the lack of platelets, and bone lesions, pain or fractures. And this can actually be caused by the calcium being leached out of our bones, because the osteoclasts, like Dr. Hourigan spoke about before, are leaching out the calcium. It's leaving those lytic lesions, almost like looking at Swiss cheese, they've likened it to. So these are some of the symptoms that from the disease itself you may or may not be experiencing. Everybody is different depending on the stage of their disease to what symptoms they may actually occur. Now I like this little slide. It says, if I don't go to the doctor, he can't find anything wrong with me, and that's how I stay healthy. So I just put this in here to remind you that if you have any symptoms, especially any new symptoms, that you let your doctor know, that you make sure that you're having that conversation with your healthcare professionals, that it's really important not to dismiss them, but to always talk about them. So treatment, of course, Dr. Hourigan touched on this, depends on your stage of disease and your general health, and it also depends on your age. Now, when we look at treatment, there are a lot of treatment options, and I know in our last talk we touched on many of these, and it's wonderful that over the years, and in the 16 years that I've been nursing, we've seen so many more treatments for myeloma being developed, and with less toxic side effects. So it is wonderful that we have so many options these days. So our treatment side effects include, well, the treatment options, and then I'll talk about the side effects, include chemotherapy. Now we know chemotherapy works on any fast developing cells, including our myeloma cells, because we know that they are fast developing, but it also includes our bone marrow, it also includes our hair, fingernails, our gastrointestinal tract, which then leads to some of the side effects post-chemotherapy. We know that immunomodulating agents, which include thalidomide, which is Dr. Hourigan spoke about, but some of the side effects from thalidomide can include drowsiness, constipation, rash, peripheral neuropathy, which I know a number of people have mentioned today. And if these side effects are severe enough in the person, we've actually seen the thalidomide stopped because the side effect is just too severe for the person to live with. We also know that we have Revlimid, which can lead to a decrease in your blood counts, an increase in the possibility of having blood clots, and again that peripheral neuropathy. If we look at the proteasome inhibitors, Dr. Hourigan spoke about how these work, which it stops the enzyme complexes in the cells from breaking down proteins, which is really important for cell division. So it stops that cell division and it stops the division of the new myeloma cells. An example of this is Velcade. Now Velcade, one of the side effects is fatigue, again, decreased blood counts, and also peripheral neuropathy. So you can see that link between a lot of the side effects that continuously come up with a lot of our treatment options, which I'm going to talk about in a minute, then what we can actually do to help deal with some of these side effects. Stem cell transplant, which Dr. Hourigan spoke about. Plasmapheresis, so when certain myeloma proteins build up, causing a thickening of the blood. We've had a number of patients in hospital recently with a new diagnosis of myeloma, who have had a hyperviscosity of the blood, so it's a thickening of the blood. And they then take those patients down and put them on the apheresis machine down in our day clinic and take off some of these cells which are causing that hyperviscosity. And then biologic therapy such as interferon, which some people in the room may have been on over the years, which is a substance which is released by some of the white cells in the bone marrow. And it can actually, so it's naturally produced, but we can actually give it to patients, and it actually slows down the growth of myeloma cells. So it can be given to patients who are in remission, but the side effects of this are oftentimes fatigue and flu-like symptoms. But generally, in a lot of the reading that I've done on interferon, it says the side effects don't outweigh the remission that it helps the patient actually have. So lastly, the last treatment that I was just going to mention is radiotherapy. With radiotherapy, we always say localised treatment equals localised side effect. So it depends on where you're actually having the radiotherapy to, which could possibly cause to what side effects you may exhibit. The two universal side effects of radiotherapy are fatigue, but oftentimes many of the patients say that that's the first symptom that they experience, and it's the last one that will actually go away, and it lasts throughout treatment. And secondly is skin reaction. So we talk all of our patients through, they have education before they start radiotherapy on how to look after their skin using lotions and potions that are very simple, that don't contain alcohol because we know alcohol is very drying, that don't contain perfumes because we know again that can be very drying to the skin. So it's simple things like Dove soap and vitamin E cream. Looking after your skin, ensuring that there's no friction applied to that area. And letting, of course, your healthcare professionals know if there's any breakdown in that area so they can talk you through exactly what lotions or dressings then to apply. So how do we treat these side effects? So we know that if our blood counts are low, if our red cells are low, we can always give a transfusion or blood product support. We can give red cells to help top up the person when it's needed. So if you need regular transfusions, you can come in and have regular transfusions of red blood cells. When we talk about infections, because when we talk about having low white cell counts or low neutrophils because of the disease, we really need to teach our patients self-monitoring. So if you think there might be signs and symptoms of an infection, to let your healthcare professionals know. To monitor, of course, your temperature, because that's going to be one of the first signs that there could be an infection. And then, of course, if there is an infection, then we can treat it. We find out the source, we can actually treat it with antibiotics, whether that be oral or it be IV in a hospital setting, but we can treat that infection. When we talk about bone disease, we were just talking in the break about bisphosphonates. Now, patients with myeloma, if there is any evidence that there may be bone disease or osteopenia, they may start you on a biphosphonate, which will help protect the bone. So it helps coat the bone, and it helps that stop that leaching of the calcium into the blood. So it helps strengthen the bones. And you could possibly be on that orally or IV, like Dr. Hourigan mentioned, and be on it long term. Pain. Now, pain may be caused for a number of reasons. It may be that there are some lytic lesions in the bone that are causing pain that could be treated with radiotherapy to help break down that lytic lesion. But also pain management is really important in our patients. So whether it be medications to help any pain, and it could be pain because you have mucositis post-treatment. You've got a breakdown of the oral mucosa in the mouth. It could be pain from the lesion or disease. We have to look at what is causing the pain, but there is always something we can do then to help our patients to take that pain away. And we always say to our patients, don't think that you have to have some level of pain, because you don't. And just like there are so many more options now for treating myeloma, there are so many more options for pain relief as well. From the simple to the more complex, but there are many, many options. And we always say that if you have side effects from your treatment, you don't have to put up with those side effects, because there are many medications that we can give to help with side effects or look at options for treatment. So please always mention any side effects to any of your healthcare professionals. Hypocalcemia. So we can give bisphosphonates to help strengthen the bones to actually stop the leaching of the calcium out into the bloodstream. So those biphosphonates will coat that and stop the calcium being leached out, so therefore lower the calcium levels. We give hydration. We always encourage our patients to stay well hydrated. If we need to give IV fluids because the calcium level's gone rather high, it may mean coming into a day clinic or coming into hospital for IV fluids for rehydration. Rest is really important. And antiemetics, because when you have high levels of calcium, you may find that you're nauseous, you might be slightly confused, you will be dehydrated, so you've got to keep up that hydration. You could find that you're very constipated, so we need to treat all of those symptoms as well as getting the calcium levels down. So it's really important your doctor will monitor your bloods regularly, but if the calcium levels are high, or if you notice any symptoms of confusion or constipation or drowsiness, to also let your doctor know. And then of course we want to watch how your kidneys are going as well. So a good indication of how your kidneys are going is through blood tests. We can look at how your creatinine's going. We want to make sure you're really well hydrated. We have had patients who, on a new diagnosis of myeloma, have required dialysis. It may just be for a short period of time, but it's just from the level of disease that they've had. But keeping hydrated is very, very important. And I know quite a few people have brought up peripheral neuropathy. This is one of the side effects that we see from many of the medications that are given for treating myeloma, and it can be experienced as pain in the hands, feet, legs or arms. It could just be tingling in the fingertips or the toes. Some people don't find it affects them in their quality of life. Others do find that it gets in the way of what they love to do. We had a lady who came into hospital and she loved to knit, and her treatment was causing peripheral neuropathy in the tips of her fingers. So she found it very frustrating because she couldn't knit. She just couldn't feel the knitting needles enough to then sit and do what she loved to do. So for her it was quite distressing. For other people it may just be a little bit of pain every once in a while in the hands, or a little bit of numbness in the feet or hands, and it may not actually affect quality of life. If it worsens throughout your treatment, it is really important to let your doctor know. It may mean that they have to look at an alternative treatment. We've had patients who've had treatment that's causing peripheral neuropathy where they've had to look at lowering the dose so that the side effect didn't increase throughout their treatment. So we can look at pain relieving medications. There are medications that do help with peripheral neuropathy. There is talk of tonic water because it actually helps with any cramping that some people do get from peripheral neuropathy. TENS machines, which have been around for many, many years. Relaxation techniques, distraction techniques. It depends on you and what works for you. It could just be listening to music that takes your mind off the symptoms that you're experiencing. And there is talk of vitamin supplements, but what I always say with any supplements is check with your doctor before you take any type of supplement or alternate therapy, just because you need to make sure it doesn't interfere with your current therapy. So there is talk of vitamin B complex, folic acid, magnesium can help with that peripheral neuropathy, and it's worth the question to your doctor to make sure he's happy with you taking them, to then give it a go and see if it helps with your symptoms. So we know that all side effects vary depending on the individual. We can have two people standing right next to each other who have the same treatment, the same sort of disease, and yet one person may have no side effects whatsoever. The other person may get the whole gamut of side effects. So everybody is very, very individual, and it depends on the dose that the patient's receiving. A lot of side effects are temporary, and that's really important to remember, that they will go away. It is just while, before, say it's to do with your disease, it may just be until you have treatment and you get those side effects under control, or while you're having treatment, if that's what the side effects are from, then they will disappear over time once treatment has finished. So it's important to remember they're temporary. When we talk about steroids, I was asked to mention steroids today because it really can alter people's lives, and they don't realise when they start to take it that it can cause stomach pain, irritation of the stomach lining. It can increase your blood sugar. So if you are diabetic, it's really important to know this because you may have to alter your doses of insulin. It may be that you've never had to take insulin before, but you're a known diabetic and you may have to take insulin while you are actually taking the steroids. Increased risk of infection. It can actually, depending on how long and what dose of steroid you're on, it can actually suppress the immune system. Increased appetite is a big one. A lot of our patients who are on high dose steroids for the time that they're in hospital will say, I just, it could be midnight and they wake up and they say, I'm just ravishing. I know I've just eaten, but I'm really, really hungry. Muscle weakness and wasting, if you're on them for a long period of time on high doses. Fluid retention, which a lot of our patients notice when they're on steroids, and blurred vision, and that's an important one to let your doctors know if you're on a steroid and you do experience that. The big one with steroids is mood changes. Now, a lot of our patients don't experience any mood changes at all, but we do have individuals who really do experience the highs and lows while they're on steroids. So can cause mood swings, can cause anxiety. We've had patients who have become very, very anxious. It could be the middle of the night where they've never had an anxiety attack before, but while on steroids they do feel their anxiety levels rise. They can become very tearful, irritable, and they have difficulty sleeping. So it's really important to take the steroid first thing in the morning if you can, because then it won't affect your sleep pattern at night time. It'll keep you up during the day, but if you take it at night time, chances are it will keep you up throughout the night. So follow all directions with your steroids. When it says to take it with food, make sure that you do. Take it in the morning where at all possible. And if you do experience mood swings, you might be tearful, let your family members know and those around you know that this is a possibility, that it is short-lived while you're on the steroids. And if people are aware that this could be a side effect, then they can be very supportive with you and offer you reassurance.